The
scientific name of the black-legged tick is Isotes scapularis. Many people still know the black-legged tick by its more common name, however, the deer tick. Black-legged ticks live in humid, wooded, brushy areas that provide food and cover for mice, deer, and other mammals. Exposure to ticks is greatest in the woods where the ticks will attach to a person or animal near ground level. Black-legged ticks crawl. They do not jump or fly, so they grab onto people or animals that brush against low-level vegetation, and then they crawl upwards to find a place to bite. Black-legged ticks live 2 to 3 years and have 3 blood meals. The life cycle begins when the female lays eggs. As the eggs mature, they develop into larvae, then nymphs, and finally adults. Any of these stages can spread disease, but the nymph and adult stages are the most commonly found on humans. The black-legged tick is responsible for transmitting 5 diseases in the U.S. These include anaplasmosis, babesiosis, the transmission of Borrelia miyamotoi, Lyme disease, and the Powassan virus. Anaplasmosis is a disease caused by the bacterium Anaplasma phagocytophilum. It is transmitted to humans by tick bites primarily from the nymphal and adult stages of the black-legged tick or the western black-legged tick. The tick must be attached for at least 12 to 24 hours to transmit the disease, and symptoms, including fever, headache, chills, and muscle aches, usually occur within 1 to 2 weeks of the bite. Anaplasmosis is initially diagnosed based on symptoms and later confirmed by laboratory tests. Treatment for adults and children of all ages is doxycycline. Babesiosis is caused by microscopic parasites that infect red blood cells and are spread by nymphal stage black-legged ticks. Transmission is most common in parts of the Northeast and Midwest and peaks during the warm months. Most people who are infected with Babesia don't have symptoms, and if they do, it's usually nonspecific flu-like symptoms. Babesiosis can be severe in people without spleens, people who are immunocompromised, people with other serious medical conditions, and the elderly. Typical treatment includes 2 prescription medications, atovaquione and azithromycin. Borrelia miyamotoi are spiral-shaped bacteria that are closely related to the bacteria that cause tick-borne relapsing fever. Infections with Borrelia miyamotoi can cause fever, headache, and muscle aches. Diagnosis relies on the use of polymerase chain reaction tests that can detect the DNA of the organism. A 2-week course of doxycycline successfully treats a miyamotoi infection. Still, much is unknown about the bacteria and the disease it causes. Lyme disease is caused by the bacterium Borrelia burgdorferi and is transmitted to humans through the bite of an infected black-legged tick. Typical symptoms include fever, headache, fatigue, and a characteristic skin rash called erythema migrans. If left untreated, the infection can spread to joints, the heart, and the nervous system. Lyme disease is diagnosed based on symptoms, physical manifestations like the rash, and the possibility of exposure to infected ticks. Most cases of Lyme disease can be treated with a few weeks of antibiotics like doxycycline or amoxicillin. Powassan virus is transmitted to humans by infected black-legged ticks. Only about 50 cases of Powassan virus were reported in the United States over the past 10 years, most of them having occurred in the Northeast region. Symptoms can include fever, headache, vomiting, weakness, confusion, seizures, and memory loss. Long-term neurologic problems may occur. There is no specific treatment, but people with severe infections often need to be hospitalized to receive respiratory support, intravenous fluids, or medications to reduce swelling in the brain. You can reduce your risk of all of these diseases by using tick repellents, wearing long sleeves and pants, avoiding bushy and wooded areas, and doing thorough tick checks after spending time outdoors.